Ancient Egypt was an advanced civilization situated in northeast Africa, dating back to the 4th millennium BCE. The civilization was built near the Nile River, which they worshipped along with their gods, as it was a major factor in their survival. Their civilization and economy was built around their agriculture, which is dependent on the annual flooding of the Nile River, which irrigated and fertilized the land. Egypt was also notable for their system of reading and writing, and also their system of mathematics, which they used for calculations. The ruins of their civilization are still around today, such as the Great Pyramid of Giza, which was built during the Old Kingdom and one of the seven wonders of the world. Due to stability of the civilization, it also gave the citizens a lot of time to think. This is how ancient Egypt was able to develop their understanding of the human body and also medicine. The Ebers Papyrus, one of the oldest preserved medical documents in existence, show that the ancient Egyptians had a pretty good understanding of bone structure, as well as some understanding of breathing, the brain, and the liver. They understood the body had a pulse and were able to associate it with the function of the heart, but they lacked the knowledge of the cardiovascular system, overlooking the idea of blood circulation. However, they did create a theory, based on when they observed damage done to a farmer's field, where an irrigation channel was blocked. This developed the idea that the human body was comprised of channels that were connected to the heart, which was the center of the system. A disease would occur when evil spirits blocked the channels of the body. This theory was named channel theory by historians. They were partially right with their theory, as the body is comprised of many different tubes, which are now known as veins, arteries, and nerves. However, the Egyptians had failed to understand that the different channels had specific purposes, a fact that they either didn't think was important or were unable to distinguish between blood vessels, nerves, and tendons. Either way, their theory proved to be a crucial breakthrough in the history of medicine, as it led doctors away from the idea to use spiritual cures for illnesses, but to instead start trying practical cures to unblock the channels of the body. A doctor of medicine, which is basically just an ancient Egyptian doctor, used a combination of natural remedies and a prayer.
Ancient Egypt has diseases that is still currently around our modern society today, like tuberculosis and malaria. However, Egypt does have more diseases than right now. Most of the diseases are parasites, like guinea worms, polio, and arthritis. Ancient Egypt heavily relied on the Nile River and is the main source of water for hundreds of years. Because of the water, Egyptians used this not only for drinking, but for agriculture, washing, and other purposes. With this in mind, still water in agriculture became breeding grounds for parasites, like schistosomiasis, a parasite that can penetrate through the skin and cause health problems as they multiply in the host. Another factor is the hygiene within the population. In that time, the hygiene quality was terrible. The mummified bodies and bones show evidence that parasite and infection may cause the body's grave and create scars on bones. Back then, people had to be sharing the river with each other, and other creatures were heavily reliant on the river as well. Since the Nile River is the only source of water, people would crowd up and create a high population density, making diseases easier to spread. Due to the high population density, clean and safe water and food supplies directly coming from the agriculture will be scarce, causing famine and weakness, which makes the body susceptible to diseases.
The doctors in the Egyptian time did surgeries to people who are not in a critical condition. Injuries that were treatable were treated immediately, injuries that were critical but not serious were observed by the doctors, and injuries that were critical and not treatable were left alone as there was no hope. To treat diseases or injuries in ancient Egypt, they used herbs, magic, and massaging. Doctors thought using natural remedies would help cure the person quick, so they used herbs. Herbs was one of their main medicine in those days. Herbs reduced the pain when they were ill. They used magic to cure injuries or diseases. In magic, they used different types of spells to cure the disease or injury. They thought spells were important as they would cure people quick and they believe in spiritual healing. Apart from herbs and magic, they also used another technique which was massaging. It relaxed the pain but took a long time to cure. Apart from herbs, magic and massaging, the doctors in the ancient Egypt did surgical procedures as they knew how the human body worked. The treatment that they used was called knife treatment. They did surgeries when they thought the person wouldn't get cured by natural remedies or magic. Doctors used tools such as knives, saws, forceps, drills, hooks, scales, and willow leaves in the knife treatment. Willow leaves are leaves that reduce inflammation and swelling.
In ancient Egypt, both men and women were doctors. The first female doctors and surgeons found it difficult to be taken seriously, even after finishing medical school. Some women even impersonated men so they could practice medicine and surgery. In this image, a mob attacks this woman, Hypatia. She was one of the first women to study mathematics and physics. Mummification played a big role and was practiced all throughout ancient Egypt. Even though religion forbade them from properly studying the bodies, those who performed the mummification would have learned a considerable amount about human anatomy. Herbs and acupuncture were also often used to cure the ill. Herbs were mentioned in records, though some not as reliable as others.